Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can watch us streaming on Roku TV, Apple TV, Fire TV, and Galaxy 19. You can watch us 24/7 on our websites at muslimnetwork.tv as well as YouTube at youtube.com/Muslim Network TV. Today we have yet another exciting episode, and we're going to be talking about a condition that affects really up to, by some reports, 50% of men over the age of 60, and that's a large number. Joining us in that discussion, I'm going to do that again. Today, so I'm just making a note, Connor. Today we're going to be talking about a condition that affects up to 50% of men by some reports over the age of 60, and that is benign prostate hyperplasia. Joining us in that, or an enlarged prostate is the other term for that. Joining us in that discussion is Dr. Justin Houman. Dr. Houman is a urologist and fellowship-trained men's health specialist whose practice is focused on male hormone management, sexual and ejaculatory dysfunction, and male fertility. As a minimally invasive microscopic surgeon, he specializes in microsurgical varicocelectomies, vasectomy reversals, sperm retrieval, penile implants, Peyronie's disease, male incontinence. Dr. Houman's practice is centered on enhancing men's quality of life through hormone management involving sexual function and achieving reproductive goals. Welcome, Dr. Houman.
Thank you. Thank you very much for having me.
Is as complicated as it was for me to get out?
No, it's a lot simpler than that.
That's good to know. Welcome. Thanks for joining us today. As I mentioned in my intro, we're going to be talking about a condition of the prostate that affects a large number of men, older men more, but of course it's something that is important for men in general and to know about. So let's start by defining what benign prostatic hyperplasia, or BPH, for the sake of brevity. Let's start by defining what that is.
Yeah, so BPH, benign prostatic hyperplasia, is essentially enlargement of the prostate, and that happens for a number of reasons. As men age, like anything else, our organs, the organs in our body, they change. And the one thing that happens with the prostate is it grows in size. So typically the prostate does two things as you age. Either it grows in size, or you could potentially develop prostate cancer, or both. So when it comes to enlarged BPH, or enlarged prostatic hyperplasia, what this is in basic terms is, think of the prostate as a donut, and the urine flows through the middle of that donut. Now, what happens is either the inside of that donut closes off, or the outside grows when the prostate enlarges, or both. And if the inside of that donut starts to grow, as you can imagine, it blocks the path of urine and could cause a lot of the urinary symptoms associated with BPH.
Interesting. Thank you for that visual. That definitely helps to explain visually what that looks like and how that can cause problems with urination, which we'll get to when we talk about symptoms. So in my introduction, I mentioned some numbers, and I mentioned that it can happen more frequently in older men. And as you mentioned also, this condition that happens as we age. But what are the numbers in general for men over the age of 40 versus over the age of 60? What are some of the prevalence and incidence numbers, meaning how common it is for you to see people coming in with this condition?
Yeah, typically, I'd say about 50 to 60% of guys in their 50s will experience this. And again, that number continues to grow as you age. Some guys, you'll never experience enlarged prostatic hyperplasia, or enlarged prostatic hyperplasia, benign prostatic hyperplasia, or the enlargement of the prostate. Other times, guys will experience that at a very young age, sometimes as early as their early 50s. So it really, it varies in terms of who gets it. Again, very, very common, very common.
Okay, so now that we've laid a groundwork to explain that this is something that most men are going to see, i.e. this is important to know, you mentioned also that two things that can happen are either the BPH or development of cancer. Now, for those who are watching, can BPH develop into cancer, or are there any links to the two?
No. So BPH, they're two separate processes. So the reason why they call it benign is because it's not a malignant growth; it's a benign growth. So it's just a benign enlargement. Versus prostate cancer, it's very different. Prostate cancer is, you're not going to so much get an enlargement of the prostate; you're going to get cancerous nodules within the prostate. So one of them is known for causing the enlarged prostate causes urinary symptoms when it comes to voiding. And prostate cancer causes, obviously, it rarely causes those obstructive symptoms. It can, but it's very rare. Prostate cancer is a different symptom. You have different symptoms when it comes to prostate cancer.
Thank you for clarifying. I definitely have patients who, whenever there's anything related to the prostate, because it's not talked about too often, except in the context of prostate cancer and getting screened, a lot of my patients come in, if they hear that word, the word prostate, they just automatically think of cancer. So thank you for clarifying that those are two very different things. And in the name, we're kind of trying to calm people that this is benign, just like you mentioned.
Exactly.
So for the average male, is there anything that predisposes them to, besides the active aging, that predisposes them to developing BPH? Are there certain risk factors that maybe they can mitigate in order to not get BPH?
So what BPH is, what prostatic growth is, it's dependent on your testosterone levels. So the way the prostate grows is through a hormone called DHT, and DHT is a byproduct of testosterone. So as your testosterone levels go up, your DHT goes up, and as a result, your prostate can grow. Ironically, so DHT is also responsible for male pattern baldness. So those are the two things that DHT does. Now, what can you do to prevent or decrease the risk of BPH? There's not much of, there's some supplements, over-the-counter supplements that some people take, saw palmetto, vitamin E, these types of things. There's not a lot of good data supporting it. Some people have started taking finasteride, which is the blocker which basically blocks the conversion of testosterone to DHT. Some people take that, but obviously that has a lot of significant side effects associated with it as well, a lot of sexual side effects. So I generally don't recommend that. But the thing I'll tell you is, because BPH is so common, there's so many good treatment options available for it. So therefore, I wouldn't necessarily be super aggressive about doing anything prophylactically to stop the progression of it. But if you are experiencing any type of voiding symptoms, like waking up at night or going to the bathroom a lot more often than you did 5 years ago, that's when you should consult a urologist and talk about your symptoms. Because again, there's a lot of good options, all the way starting from just simple medications to aggressive surgery. But because it's so common, plenty of treatment options.
That's good to know. So nothing really that you would really recommend prophylactically, like you said. And
nothing good. No.
Nothing good. Yeah, no good evidence. So you started to mention some of the symptoms, which is exactly where I'm going next. What are some of the symptoms? You said waking up at night. That's one I get very frequently from patients coming in complaining of that, thinking that they may have a urinary infection. And then we test them and it's negative. But what are some other symptoms that are commonly seen with men who have BPH?
Yeah, so if you think about it, because it's that you're obstructing the path of the urine from the bladder outwards. The things that typically guys complain about is, the first thing they notice is like, my urinary stream is not like what it used to be. It's a lot weaker. It's, before it was hitting the back of the toilet bowl. Now it's barely making it into the bowl itself. So weak urinary stream, nocturia, which is waking up at night to urinate, not just waking up, but waking up at nighttime in order to urinate, or even going to the bathroom. We call it frequency. So whereas before you'd be able to hold your urine 4 or 5 hours, now you're going to the bathroom every 2 hours. But the big picture here is, because it's such a broad spectrum in terms of what BPH could do in terms of symptoms. a very important question you have to ask is, how bothered are you? So some guys, they wake up 3-4 times a night, and you ask them, are you bothered by that? They say no, which is, fine. Other guys, they wake up one time a night and they're very bothered by this. So as important as those symptoms are, the impact on your quality of life is just as important.
That's a great point. It's always it's always a balance as far as symptoms and then quality of life how the symptoms are affecting quality of life is what I mean. And so it's really important that you mention that, because some people may have those symptoms, but they've adjusted and it doesn't bother them, versus other people, it's really affecting their ability to rest or do other things. And so it becomes a bigger pain, really, and they need to seek help. Along those lines with symptoms, Dr. Houman, let's talk about, are there specific times when someone should immediately go and seek help? Are there emergency symptoms when it comes to urinary symptoms? Because you went over there, as you said, they're majority urinary related symptoms. Are there any symptoms that a male might think, if I have this, I really need to go and seek help ASAP?
Yeah, it's a good question. So, this is plumbing. This is just plumbing. That's the thing everyone has to remember here. It's, as urologists, we don't deal with life and death too often. It's a lot of quality of life issues. So we're just plumbers, and this is plumbing. So for the most part, you're going to be okay. You should seek consultation at some point, within a couple days, couple weeks. But there are certain situations where you should, potentially have to go to emergency room. Really what that is if you cannot urinate. So sometimes that prostate, that channel closes up so much that essentially your bladder can't empty, right? And that's called urinary retention. If you ever go to a state of urinary retention, you're not able to urinate. And if you're not able to urinate, it really backs up your kidneys and it causes kidney damage. And there's a lot of issues with that, obviously. That's probably the only time you should ever, or that's the main reason why you should, in terms of an emergency reason when it comes to enlarged prostate. But otherwise, it doesn't require, immediate evaluation. That's the only reason why, urinary retention.
Okay, thank you. That's great to know and useful information for our audience, I'm sure. So we're just going to have to take a quick break right now, and then we'll be back after a few messages here to keep talking about BPH. You're watching What's Up Doc on Muslim Network TV, and we'll be back after these few messages.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are talking about a condition of the prostate called benign prostatic hyperplasia. Joining us in that discussion is Dr. Justin Houman. Before the break, Dr. Houman, we were talking about some of the common symptoms of BPH, and we were also describing emergent symptoms such as not being able to urinate or void at all, being something that we would recommend people in our audience who suffer from that to seek help immediately, of course. Now, another question that I get often from my patients relate to another condition of the prostate or prostatitis, and with that they experience pain. Can you briefly just describe the difference between that and BPH to reassure patients as far as, because when we went over the symptoms, pain was not on that list, I noted. And so let's just briefly distinguish for our audience who might be suffering or experiencing pain and what that might be.
Yeah, so prostatitis is common as well, but prostatitis is very different than BPH in the sense that prostatitis is essentially inflammation of the prostate rather than enlargement of the prostate. So this is not a growth, it's just inflammation. So how does the prostate get inflamed? A couple ways. Two main, the way to break it up is there's a bacterial inflammation, where there's bacteria that irritates the prostate and it causes it to become inflamed. And then there's non-bacterial. So bacterial inflammation probably comes from, the way you think about it is most of the time it's UTI related. You'll get a urinary tract infection. Some of that bacteria sits on the prostate and infects the prostate, causes it to get inflamed, and then you get prostatitis symptoms, pain being the main one, typically at the tip of the penis. Non-bacterial prostatitis, this is a little bit, this is more for young guys. Younger guys generally experience this. And this is just, think of it as it's either an overuse issue or it's a issue when it comes to irritating the prostate. So things that can irritate the prostate, a lot of it has to do with your diet. Spicy foods, caffeine, and alcohol could definitely irritate that prostate and cause prostatitis type symptoms. And a lot of times it's overuse, whether let's say you're typically not used to ejaculating a lot. So if you go through you're ejaculating a lot more frequently, that prostate's obviously heavily involved when it comes to the ejaculatory mechanism. That could potentially cause prostatitis symptoms.
Okay, thank you for clarifying and differentiating those two things out for us. That's a very great explanation. Let's talk now about how BPH is diagnosed. So we've got the general symptoms. You're going to go in and see your doctor because you're having some of the symptoms Dr. Houman described. What are some of the tests, if there are any tests, that your doctor would do in order to diagnose BPH?
Yeah, so
before I say that, the reason that I want you to share maybe in order of what we would think of first is because a lot of my patients automatically think that I'm going to ask them to turn around and do a digital rectal exam on them. And that is their worst fear because they're always looking at my hands and they're like, are your hands before you do that?
Yeah.
So let's talk about that and then some of the other ways that we can diagnose that.
Yeah, so it's I mean that is obviously a prostate exam. I mean, as a urologist, that's what we do. So the prostate exam is obviously important. Is it the number one most important thing when it comes to BPH? No, but it's part of the spectrum of, or it's part of one of the many tests that we do. Um, really, the first thing is it's a discussion, right? You tell us, you express to your doctor, your urologist, what is bothering you, whether it's waking up at night, whether it's the frequency, whether it's the urinary stream, the weak urinary stream. And then we have a great tool now. It's called the AUA, it's our Urologic Association symptom score. What it is, it's a survey, and you answer questions where basically it gives us a sense of where you are in terms of mild, moderate to severe BPH symptoms. That's really a very important clue in terms of figuring out what's going on with the prostate. In addition to that, there's some pressure studies that we could do that we, as urologists, we do in the office, where we're able to measure the stream of the urine. We're able to do an ultrasound in the office to see how much urine is left in the bladder. And all of these, there's a subjective where you tell us, and then we gather objective data. And using both of these, we're able to figure out exactly what's going on, what's causing your symptoms, and what we could do for it.
Excellent. So you mentioned that there's two parts of it, like you said, the patient complaint and then the testing that we do. One of the testing, does any of the testing involve blood work? Because another question I frequently get asked is measuring the PSA, the prostate specific antigen. And my patients usually, I've had some patients tell me that they just want it checked yearly because that'll tell them if there's something going on with their prostate, as opposed to symptomatically expressing that they're having symptoms, right? Like you said, that's the subjective part. So how useful is the PSA in diagnosing and management of the not in prostate in general, but specifically with BPH? Because I know the other question is a controversial one.
Right, exactly. So, I mean, we don't use PSA to measure BPH levels, right? Or your size of your prostate, or it's not. PSA is used for prostate cancer. It's one of, again, that's a different topic, but that's used in order to track, and it's used one of the tests that we use to see whether or not evaluate your prostate cancer. It's not used for BPH. However, let's say you come to your urologist, you haven't had a PSA checked, or you haven't had it checked in the last, or it's been a few years since you checked it. Yeah, absolutely. I think we do a blood test to make sure your PSA is on par, or we just want to compare it to previous years. But that's the only reason why we would evaluate your PSA when it comes to BPH.
Excellent. Thank you for clarifying that. So now that we've discussed how to diagnose, what are the symptoms, you've very clearly outlined that treatment really depends on how bothersome the symptoms are. So of course, we know that this is going to be part of the answer. But in moving towards treatment, outside of just the symptomatic management, meaning patients are complaining of specific symptoms that are bothersome, is there like a size of the prostate after which, even if they're not having symptoms, you would treat?
Even if they're not having symptoms?
Yeah. So let's say they're having symptoms, but it's not as bothersome. So you mentioned that survey, right? As far as how it's quality. Let's say they score low on that. It's not affecting them that greatly. But when you do the diagnostic portion, you're seeing that the volume of the prostate is quite large. Would that affect your treatment options, or would you just say, well, we'll wait until you have symptoms?
Yeah, that's a good question. So that's the part where it becomes a discussion between, for me at least, it's a discussion between myself and my patient, where we talk about it. We say, hey, listen, your prostate is large. And this comes back to that same thing we talked about with the donut. Sometimes the outside of that donut's growing, not so much the inside. So even though they have an enlarged prostate, that channel could be open, right? It's more open than most guys. So in that situation, you say, listen, if you're not bothered by this, you're not waking up at night too often, or even if you are waking up at night, but you're not bothered by this, and it's not causing any kidney issues, hey, listen, there's nothing we do. Let's just continue to monitor it, right? Because the thing about BPH is it never gets better on its own. It can only get worse. It can only stay the same, it plateaus, or it gets worse. It never improves on its own. So the only way it improves is some kind of intervention, whether it's medications, a procedure, surgery, something like that. So, but ultimately, it's a discussion between myself and my patient.
Excellent. I love that. Individualized medicine. I'm all for it. There's definitely no one cookie cutter response or treatment for everybody across the board. And so now that we know that, okay, it's going to be an individualized effort to decide on treatment, what are those treatment options? Let's start, if there is anything with lifestyle modifications, if that's possible to include in with the treatment, with the medications, excuse me, or are you usually just jumping straight into medications as a treatment option?
Yeah, lifestyle modifications, things you could do. Again, most guys usually come in because they're having nocturia, waking up at nighttime to urinate. So some lifestyle modifications they could do is just decrease the amount of time or limit their fluid intake after 6, 7 p.m. So that way, their diarrhea or they're emptying their bladders or their kidneys are basically, or they're urinating, a large amount of what they're urinating is done before going to bed. And that way they're not producing as much urine at nighttime, and then obviously they're not going to wake up at nighttime as often. So that's the main lifestyle modification. Otherwise, when it comes to the enlargement of the prostate, there's not much else in terms of significantly beneficial lifestyle modifications.
That's good to know. I think I had read some source where exercise might have some improvement, but I think that that's just a blanket statement for everybody to get more exercise. All right. So I do want to talk about medications next, but we have to take a quick break here. So we'll do that. And then when we come back, we'll jump into medications and then potentially surgical or procedural options as well.
Perfect.
You're watching What's Up Doc on Muslim Network TV, and we'll be back after this short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. If you could see you through my eyes instead of your ego. I believe you'd be surprised to see that you've been blind. Walk a mile in my shoes. Walk a mile in my shoes. Yeah, before you abuse, criticize and accuse. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize and accuse. Walk a mile in my shoes.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum. Welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm joined by Dr. Justin Houman today. We are talking about BPH, or benign prostatic hyperplasia. So before the break, Dr. Houman, we had started the discussion of treatment options, and we had started with lifestyle, which doesn't sound like there's really too much there. So let's move on to talk about medications and medication options. What do you usually start with, or what do you, in general classes, I guess, treat your patients with?
Yeah, so typically you start patients off with what we call alpha blockers. So alpha blockers are medications that help open up the middle of that donut, right? That area that could potentially block the urinary stream. This helps open that up and allow for improvement of your BPH symptoms. So by opening that up, you get a stronger stream. You're not urinating as much because you're emptying the bladder more. And then with that, you're not waking up as much to urinate. So that's generally the main one. There's also that medication I talked about earlier, the one that blocks. So I'll say this about the alpha blockers. There's a few of them. They generally, they work relatively quickly too, which is good, right? Versus the other medication, which I alluded to earlier, which blocks the conversion of testosterone to DHT. So that one acts more hormonally. What that does is it shrinks the prostate, actually shrinks it. But that takes anywhere from 3, typically 6 months for it to start to kick in. That one has significant sexual side effects associated with it for some guys. It could really cause issues with erectile dysfunction, libido issues, and just basically you don't have that sex drive that you used to. But anyways, those are the two main forms of therapy, the oral ones at least.
Okay, so it sounds like you have a clear favorite in what you prefer based off of the side effects. Yeah. What are some of the side effects though with the alpha-1 blockers? Are there, or if there are, I mean, all medications have side effects, so I'm sure. And I'll just share one with you about one of my patients actually preferred to go with the second class because he said that as soon as he was started on an alpha-1 blocker, he felt like he was about to pass out. And so he had severe dizziness. So I'm going to start out with just sharing that as a potential side effect and let you finish off with some of the other side effects that you might see.
Yeah, that's a great point. So that's obviously a common one, or a more common one. But what it is so the same way it dilates or opens up that prostate, what it also does is it opens up and dilates your arteries, basically your blood vessels. So in doing so, some guys get lightheaded, they get dizzy. So that's why we always recommend taking the alpha blockers at nighttime, right before bed. So you're going to bed, you're not walking around, you're not functioning while you're on this medication. So you are getting, so the chances of getting dizzy and passing out are a lot less. The other one that some guys talk about is something called retrograde ejaculation. So because again, it's opening up that prostate, some guys, when they ejaculate, the ejaculate, so the semen doesn't come out through the penis. sometimes it shoots up in a retrograde and backwards fashion, and it goes into the bladder. Now, is that harmful to you? No. Is it bad for your urinary tract? Not at all. It's just sometimes it's a weird feeling, number one, and sometimes it's odd for guys to orgasm, but nothing else, but nothing comes out. Some guys prefer it because it's cleaner. Other guys really dislike it because they like to experience that portion of the sexual experience. But there are some alpha blockers that minimize the chance of retrograde ejaculation. So plenty of options. Again, because BPH is so common, we have so many good options available, and each year we're coming out with better and better options.
Awesome. So from what I understand, some of the newer generation medications have probably less side effects and better efficacy in helping patients. Okay. So those are the medication options. What else can we do if medications either fail or a patient does not want to do oral medications? What are the next steps that you would take in treating this?
Yeah. So, historically, the next step would have been something called, basically be surgery, right? Where we go in there and something called a transurethral resection of the prostate. So what that is essentially it's a roto-rooter procedure, where we go in there with a camera through the penis. There's no cutting involved, no cutting of skin. So we just put a camera through the penis and we core out that inside of that donut. So the inside of the donut may be this small. And then when we do the roto-rooter, it grows, right? Excuse me, that lumen, that channel opens up. So it allows for more urine to flow through there. Now, we've been doing that for decades. That's surgery. But now, again, because we've come out with so many new options, and this is something that we do in our office, there's in-office procedures where we could go in there and open up that channel, either through mechanically opening it up through a staple. That's something called urolift. There's something called resume, where we go in there, we inject water vapor into the prostate. And in doing so, that prostate dies off, that prostatic tissue, that channel that's blocking that prostate, that'll open up and allow for improved urinary stream. And now there's something called aquablation that's coming out. But I'd say, I go so far as to say that the TURP and the invasive surgical procedures are a lot less common now than these in-office procedures that we're doing. Generally done under local anesthesia. You come into our office, we take care of it, and then you're able to go home that same day and have great efficacy and great results relatively quickly after the procedure.
Awesome. Yeah, I always find it so fascinating, the different procedures that are available for the treatment. And even more fascinating is just how quickly, like you said, patients experience relief from symptoms same day. So I think it's amazing that we have those options. Now, given that we've kind of gone over the treatment options at this point, what are the chances of recurrence? So is this a once in a lifetime thing and then patients are good, or is there a risk of recurrence, and how high is that risk?
With BPH?
Yes, with BPH, with the symptoms coming right back.
So it depends, right? So sometimes, well, like I said, right, the prostate is going to continue to grow in size as you age, right? Inevitably. There's things we could do to mitigate that. Finasteride, that medication I talked about, that shrinks it. But some guys, that medication may decrease the growth rate, but it doesn't stop it. So, it's not uncommon for guys to have a procedure done for their prostate, let's say a TURP or these in-office procedures like a resume, which is a great option for a lot of patients. And then 10, 15, 20 years later, that prostate has grown in size just enough to start causing more, similar symptoms to what they were experiencing, and they require another procedure. That's not uncommon, normal, and it's part of it. It's just part of it because, again, that prostate will continue, for most guys, it will continue to grow year by year.
Thank you for sharing that, Dr. Houman. Thank you for answering a lot of these questions that patients are asking commonly, and for sharing your expertise and your knowledge with our audience. Really appreciate your time and coming on this show today.
Absolutely. Thank you. Thank you for having me. I appreciate this.
Of course. Thank you for joining us on another episode of What's Up, Doc. You can watch our other episodes on our website at muslimnetwork.tv and on our YouTube page. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc?